I have the pleasure of talking about endocrine pathology, and I'm going to be giving 3 lectures. So I'm starting, of course, with the most common, which is thyroid. And I'm going to focus on thyroid neoplasms. I have a number of disclosures, none of which have anything to do with thyroid pathology. They're all about digital, so I'm not going to concentrate on that. And we won't waste time on goals and objectives. You've had a couple of themes already in the lectures today, and some of them are about the art of pathology. So I too have some interest in the art of pathology, but I don't look for animals in crypts. If anybody's interested, we can talk about some of the interesting things in some of the pictures I'll be showing in my lectures. There is a long history of thyroid pathology, and if there's one thing I'm going to convey to you in this lecture, is that nobody really knows anything that we're talking about in thyroid. Everything is opinion, and everybody has a different opinion. And part of that is historical. So I just want to go over the history of our understanding of thyroid neoplasia and why we're all so confused. So if you go back to the 1950s and 60s, thyroid pathology was really easy. There were benign and malignant tumors. They were called adenomas and carcinomas. And carcinomas were well differentiated when they were classified as either papillary or follicular. And that was almost entirely based on architecture. So if a tumor had papillae, it was papillary carcinoma. If it had follicles, it was follicular carcinoma. And there really wasn't much complicated. And then, of course, there were bad tumors that were less well differentiated and anaplastic carcinomas. Now, in 2017, the classification changed dramatically because we created a whole new category of borderline tumors, which is great if you're a fence sitter, so you can just kind of put things there and not worry about it. And then we added the concept of Hürthle cell carcinoma, which kind of was historical but never really was given its due. And that's kind of the next step of confusion. And now this is the new 2022 WHO, which is not yet published, but is in press. And there's a review article that just came out in endocrine pathology that's talking about this whole new classification. So let me point out to you what's new here. The most important thing is that, first of all, benign tumors aren't just adenomas anymore. We've included this very interesting multifocal disease that we see every single day in the microscope. I'm going to talk a little bit more about that. We've also recognized a class of papillary tumors that are benign, and I'll talk in a bit more detail about that as well. And of course, we have now oncocytic adenomas separated because we're trying to understand more about the different types of adenomas. In the what used to be called borderline is now low-risk tumor category, we have NIFT-P. I'll talk a little bit about that as well. We have uncertain malignant potential, which is really about the fact that we can't describe invasion properly. And then, of course, this funny thing called hyalinizing trabecular tumor. In the malignant category, we've made some changes, and you're going to see that we've actually separated out papillary thyroid carcinomas, which are clearly papillary carcinoma, from the encapsulated follicular variant papillary carcinomas and follicular carcinomas. And I'm going to go into the molecular biology of this because ultimately papillary thyroid carcinomas are a very different beast from anything that has almost exclusive follicular architecture. And these two are actually very much alike. We still have an oncocytic tumor, but it's very clearly defined in the new WHO as being the oncocytic variant of follicular thyroid carcinoma. And I'm going to be the first to ask, why does it get a special designation when oncocytic papillary carcinomas don't? But this is, out of respect to certain people on the committee. And now we've got a focus on what we're going to call high-grade tumors, and I'm going to show you some examples of those.